4B, bias, confounding, and other experimental errors. So, things that can go wrong if we do not have a very carefully and very well designed experiment. Alright, first thing is bias. Alright, I want you to think about something. This is called the Hawthorne effect. When subjects change their behavior because they know they're participating in an experiment. Alright, so when people know they're part of an experiment, they might act a little differently. If you were part of a weight loss experiment, you might really pay attention to what you eat. Okay, whereas if you were just going about your normal life, you probably would have that extra piece of candy or whatever. Alright, so to try and eliminate that human factor, that Hawthorne effect, alright, we use something called blinding. Alright, and blinding is when people do not know what treatment they are receiving. So in a single blind experiment, the subject does not know what treatment they're receiving, but the experimenter does. So if I'm testing a new medicine, all right, I'm going to give some people the actual medicine, and I'm going to give some people the placebo. And I know what they are getting, but they don't know. So they don't know whether they were given the medicine or given just a fake pill that does nothing. All right, in a double-blind experiment, nobody knows. So it's the groups are randomly chosen, all right, and then assigned their placebo or actual medicine without the experimenter's knowledge. All right, so it's done by like a third party, and then we don't know who had what until after when we go to look at the results. All right, so in a double-blind experiment, the subject doesn't know, and the experimenter doesn't know. And this is because experimenters are human, and so they could be subject to biases too. So if it was a medical trial, and I know that this person is getting the medicine, I might try extra hard to help them with whatever they're struggling with. Whereas if I knew someone was getting the placebo, I might think, well, they're not going to get better anyways because they have the placebo, and maybe not give them my full attention or expertise. Alright, confounding is when there is something besides the explanatory variable, something besides the thing that we're actually trying to test, that accounts for change in the response variable. Alright, and so we have to be very careful when we're designing experiments to make sure that these things, that we can limit or eliminate, ideally, their presence. So an example would be if it was a weight loss study, okay, and maybe all of the people in the group that got the new exercise workout, maybe they were all under the age of 30. And then all of the people that did not, that were in the control group, maybe they were all over the age of 30, and that could happen by accident. All right, but then age is a confounding or a lurking variable there, because we don't really know, did they lose more weight because of the exercises we gave them, because of the workout, or did they just lose more weight because they're younger and it's easier to lose weight when you're younger? Alright, so that would be a confounding variable, and that would be an example of maybe where we could use a block design to eliminate age as a confounding variable. If I make sure that half of the under 30s are in each group and then half of the over 30s are in each group, then I can eliminate age as a reason for the results. Alright, and then other issues that can happen, and this list is not all inclusive, but this is what we're going to talk about in this class. You can have non-adherers. Alright, so people who don't do what you tell them to do as part of the experiment. So if for the experiment you're going to take this weight loss drug and you're supposed to exercise 30 minutes for 3 days a week. Alright, and that is the protocol, that's the treatment that we are giving them. If they don't do that exercise, they're non-adherers, and they could mess up the results of the study. Because if the pill requires exercise for it to work, and they don't exercise, alright, then they're not doing the treatment the way that we prescribed them to, and it could mess with our results. Alright, so non-adherers are one problem, and then dropouts are another. So you'll have people who will stop in the middle of the experiment. So if we're testing this drug for 6 months, and they stop taking it after 2 months. Alright, now they've shrunk our sample size because we can't really use their 2-month data and compare it to everyone else's 6-month data. Alright, so that would cause problems as well. All right, and that is it for 4B.